Hello and welcome. Today, we're diving into a condition that affects the female reproductive system, endometritis. We'll explore what it is, its causes, symptoms, and how it's treated. Whether you're a medical professional, a student, or simply curious, this video aims to provide a comprehensive overview of endometritis. Endometritis at its core is an inflammation or infection of the endometrium, the lining of the uterus. The causes vary, but it typically arises from an infection. Acute endometritis is often triggered by infections related to childbirth, particularly after a cesarean section, prolonged labor, or retained placental fragments. Other potential causes include sexually transmitted infections like chlamydia and gonorrhea, uterine procedures like dilation and curettage d'Encea or hysteroscopy, and the insertion of an intrauterine device or IUD. Chronic endometritis, on the other hand, is often associated with persistent infections, retained placental tissue, or bacterial vaginosis. Sometimes it can occur with no identifiable cause, making diagnosis more challenging. Let's delve into the how and why of endometritis. The pathophysiology depends on the type of endometritis present. In acute cases, the inflammatory response is strong and swift, with neutrophils, a type of white blood cell, flooding the endometrium. This inflammatory surge causes the classic symptoms of fever, pain, and discharge. In chronic endometritis, the inflammation is more subtle but persistent. Plasma cells infiltrate the endometrial stroma, often leading to subtle changes in the endometrial lining's function. This subtle but prolonged inflammation can then lead to various reproductive issues such as infertility or recurrent pregnancy loss, as implantation of a fertilized egg may be hampered. The infection and inflammation can disrupt the normal hormonal and cellular processes essential for a healthy uterine environment. Endometritis isn't uncommon, but pinpointing exact numbers is difficult. Acute endometritis is most frequently observed postpartum, particularly after a C-section. The risk increases with factors like prolonged labor, premature rupture of membranes, and multiple vaginal examinations during labor. Chronic endometritis is more challenging to estimate, as many women might be asymptomatic or have non-specific symptoms. Studies suggest that it may be present in a significant proportion of women with infertility or recurrent pregnancy loss, but its true prevalence remains under investigation. Risk factors for chronic endometritis mirror the causes: previous pelvic infections, retained products of conception, and certain uterine procedures. The signs and symptoms of endometritis can vary widely depending on whether it's acute or chronic. With acute endometritis, women often experience intense pelvic pain, fever, abnormal vaginal bleeding, or discharge that might be full, smelling. The uterus may also be tender to the touch. Chronic endometritis can present with more subtle symptoms, such as abnormal uterine bleeding, pelvic pain, infertility, or recurrent pregnancy loss. Some women with chronic endometritis may have no noticeable symptoms at all, which can make diagnosis more difficult. Diagnosing endometritis involves a combination of medical history, physical examination, and diagnostic testing. In acute cases, the symptoms are often suggestive, and a pelvic exam revealing uterine tenderness can further support the diagnosis. However, lab tests are essential. A complete blood count can reveal elevated white blood cell counts, indicating infection. Endometrial biopsy, where a small sample of the uterine lining is taken for microscopic examination, is crucial for confirming chronic endometritis. The presence of plasma cells in the endometrial stroma is a hallmark sign. Additionally, cultures of endometrial tissue or vaginal discharge can help identify the specific infectious organisms involved, guiding targeted treatment. Hysteroscopy, a procedure where a small camera is inserted into the uterus, may also be used to visually assess the endometrial lining and obtain biopsies. We touched on the classifications earlier, but to reiterate, endometritis is primarily categorized as acute or chronic. Acute endometritis is a sudden and severe infection usually related to childbirth or a uterine procedure. Chronic endometritis is a long-standing, often subtle inflammation of the uterine lining. There is some emerging research attempting to further classify chronic endometritis based on the specific inflammatory markers present, but this is not yet standard clinical practice. Treatment for endometritis hinges on identifying and eradicating the underlying infection. Acute endometritis is typically treated with intravenous antibiotics. The specific antibiotics used depend on the suspected or identified causative organism. If retained placental fragments are present, a dilation and curettage or D&C may be necessary to remove them. Chronic endometritis is generally treated with a course of oral antibiotics, most commonly doxycycline or a similar medication. Repeated biopsies may be needed to confirm eradication of the infection. For patients with infertility, treatment of chronic endometritis can significantly improve their chances of conceiving. Prevention is key in reducing the risk of endometritis. During childbirth, meticulous hygiene and adherence to sterile techniques are crucial. Prophylactic antibiotics may be given to women undergoing cesarean sections to reduce the risk of infection. Proper treatment of sexually transmitted infections can prevent them from ascending into the uterus and causing endometritis. For women undergoing uterine procedures, ensuring sterile conditions and appropriate pre- and post-operative care can minimize the risk of infection. Lastly, avoiding douching can help maintain a healthy vaginal flora and reduce the risk of bacterial vaginosis, which can contribute to endometritis. The prognosis for endometritis is generally good with prompt and appropriate treatment. Most women recover fully without long-term complications. However, untreated endometritis can lead to more severe issues, such as pelvic inflammatory disease, PID, infertility, ectopic pregnancy, and chronic pelvic pain. Recent research focuses on improving diagnostic methods for chronic endometritis, exploring the role of the microbiome in endometrial health, and investigating alternative treatment options, such as immunomodulatory therapies, for cases that are resistant to antibiotics. Understanding the complex interplay between the immune system and the endometrium is a growing area of research with the potential to improve outcomes for women affected by this condition.